This meeting is being recorded.
Disconnect from monitor. We're muted. We're muted. Hey Tony, can you hear us?
Can you still use your that on Zoom?
I don't know. That's a good question.
There's Jerry.
Everybody.
Hi, Jerry.
So small. I see James around.
Did you do it with the attendee? Call the number out. 415-655-0001.
Welcome to WebEx.
925-629-008. Pound. 315.
This meeting is being recorded.
Because it's muted.
Thank you.
So should we just,
This is all. See if you can pick us up on volume. So Lisa, we kick it off or do they kick it off? Okay. Hi everyone. I don't know if you can hear us okay. I see the Erlanger team is on. Can you all hear us okay? Hopefully. We're on.
This is the Parkridge team. We can hear you.
Oh, Parkridge, you can hear us. Oh, hey y'all.
Morning.
Good morning, everybody.
Hi, Tim.
Hey, Matt.
Okay, so Parkridge can hear us. How about Erlanger? Can you all hear us? Can you text them? You know, Dr. Sizemore's number? How about the media folks? Can you all hear us?
We can hear.
Okay.
Yeah, I do.
Dr. Grant, we're going to text the folks at Erlanger and see if there's something that they can do to turn on so they can hear us.
Okay, we had heard them speaking earlier, Tony. So I'm not sure why we can't hear.
And multiple cameras.
Huh. Okay.
Oh,
You guys are driving this from a tech perspective, right? So I'm looking at my board. I can't change volume or anything. I think we're good. I mean, I hear you guys fine.
I'm checking the PIO.
Oh, okay. Oh, I'm sure they're in there.
Yeah.
Yeah.
We don't have their
I
number.
had to text Dave Sizemore. He's got the doctor in there. But I don't have the other doctor. She's going to reach out to them.
Actually, I don't see Erlanger on the screen any longer. I saw them earlier. Dr. Grant, can you see them on your screen now?
No, we only see you guys.
Okay. Then
Maybe they bumped off and try to come back in.
Can we hear any of the media?
This is Shannon with WTVC. Can you hear me?
Yes.
Yes.
This is Emily with WRCB. Can you hear us?
Yes.
Yes.
This is Joy Dukes with Channel 3. Can you hear me?
Yes.
Thanks.
This is Elizabeth with the Times Free Press. Can y'all hear me?
Yes.
This is Joseph with the Chattanoogan. Can you hear me?
Yes.
So it sounds like we have everybody but Erlanger at this point.
Okay. We'll give them a little extra time.
Hey guys, this is Latricia with WTVC. Just a procedural question. In some of our other WebEx press conference meetings, if we have a question or want to get in line to ask a question, we raise our hand on here. Is that the way you guys want to handle it as well?
Yeah, that'd be great. We'll come to you as we see it through the technology.
Thank you.
Yeah, again, on that point, I think the PIOs have briefed all of you. We'll let, obviously, Erlanger get on, but our point would be to do quick introductions of the three health centers and the folks that are in the rooms. And then we'll go a round table to each to kind of give a 3 to 5 minute briefing on our plans to start the reopening process. And then from there, we'll start questions. Hopefully that still works for everyone. Did you get him? You get him?
I didn't respond.
I texted her.
Okay. That's weird. I saw them. I could see them, but I couldn't hear
There
them.
must be an issue. I didn't respond. I told him they disappeared.
Nobody wants to disappear just yet, right? Dr. Grant, how y'all doing?
We're doing well. How about you guys?
I think so. All things considered, yeah. Yeah, ready to see how this thing goes, right?
Right. I think it's time.
Yeah.
Hey guys, the Erlanger folks are finally on. We were having technical difficulty.
Well, good. I can hear you all. Can you hear us okay?
Yes, we've got you now.
Oh, perfect. Okay, great. So why don't we go ahead and get started? Again, we'll do some introductions from the three healthcare systems, and then we'll let each do a quick introduction about our plans for the reopening, and then we'll allow members of the press to kind of start the questions. So good morning. My name is Anthony Houston, and I serve as the President and Chief Operating Officer here at CHI Memorial, and I'm joined by...
I'm Matthew Kodzi. I'm the Vice President of Medical Affairs here at CHI.
And Dr. Grant, we'll go to you.
Here, I'm Tim Grant. I'm the Chief Medical Officer for Parkridge Health System.
I'm Tony Sylvester. I'm the Director of Emergency Preparedness for Parkridge Health System.
We'll go to Erlanger.
I'm Ron Bukait, Medical Director for Disaster Medicine here at Erlanger Medical Center.
And I'm Jay Sizemore, Medical Director of Infection Prevention.
Great. Thanks, everybody, again, for joining us this morning. Our intention is to, I think, hold through till about quarter after the top of the hour, so 9:15. Again, we'll look to answer your questions as each of us finishes our kind of preview or overview of what our reopening plans look like. So we'll get started here at Memorial, and then we'll push it over to Parkridge, and then we'll finish with Erlanger. Again, here at CHI Memorial, like the entire community, we stopped our elective procedures on Saturday, the 21st of March. Prior to that, obviously the schools started closing. We started to activate much of our social distancing in our community. Also at Memorial, we put in place universal masking starting on March 24th. And we believe that's really helped our healthcare community inside Memorial at our three campuses and our physicians' offices continue the good practice of keeping this virus away from us. I think many of us have understood over these last weeks that masking is really about protecting others from us. It's not about protecting necessarily you from others. So if we were asymptomatic carriers of the virus, by having these masks, we would help protect those in vicinity of us. So we've been doing that. We feel really, really confident in that. We've also activated much of the social distancing related to our facilities, but also we've restricted our visitation policies. So as we think about reopening, I'll have Dr. Kazi join in with some further detail. We're going to continue those practices, continue the practice of universal masking. We'll continue the restrictions of visitation, continue the social distancing work within our facilities. We also check each and every one of our entrance to the campuses, so all of our employees, all of our medical staff members have a temperature check as they come in, and also ensure that they are masked. So we'll continue to do that. We'll also do that for any patients coming into the campuses, and also for the visitors. We do have some visitation allowed at end of life and for some other unique circumstances. And if those people will come on the campus, they'll also be monitored for temperature and mask. So I'll just tell you what we've done, and I'll turn it over to Dr. Kazi for a little more detail. We have a group of physicians that have been planning our reopening. We're really looking at a measured approach as it relates to coming back to ensure that we practice, again, the procedures that we just described. And so we won't anticipate going to 100% of our normal run on May 4th, but we do anticipate allowing some elective procedures to happen. And really, in closing for me, we need to take care of our community. The hospitals are safe. We've done these measures to keep each other safe, keep our community safe, and we realize people are still needing healthcare services, and we need to take care of our community despite having to take these precautions for the virus. So I'll turn it over to Dr. Kazi for a little more detail.
Thanks, Tony. As Tony was saying, our great concern right now is that there are those who need health care who either been unable to or too concerned to come to the hospital for the care that they need, and their health is declining. And we are doing this session in many ways to reassure individuals that the hospital has been made a safe place, and we've kept it a safe place. And in that sense, we have kept any patients with any suspicion of carrying this virus in select regions of the hospital away from all of the other patients. We separate them as early as the point at which they come into the emergency room. They are immediately evaluated and sent on a separate route if there is any suspicion. That said, and with that safety in mind, we want to let the public know that we, as the other hospitals in town, are planning on resuming a certain degree of our prior services. I know one of the questions has been about elective surgeries, which were put on hold, as Tony was saying. And we have had specific committees addressing those issues. Where do we start? How do we start? With what types of cases do we start? So certainly we're not going to go to full volume. We're going to go to a fraction of that. We're going to ramp up just a little bit and make sure that the processes keep our staff and the patients safe. And with that said, we've asked our physicians to evaluate their patients. We're giving them certain criteria and techniques to say which are the patients who are probably the safest to go ahead and bring in for surgery. And at the same time, encouraging them to make sure that those patients who clearly need surgery, who are urgent in that sense, continue to come to the hospital, which is something we've done throughout this. In evaluating those patients, I know there are a lot of questions about testing for a virus, testing for infection. And at this point, our approach is going to be to continue what has kept us and our patients safe throughout this pandemic to this point, which is masking ourselves, as Tony was saying, masking the patients, screening patients with specific questions to look for any signs of infection. We've added some questions to the standard cough, shortness of breath, fever, given the symptoms that have been seen with this disease, things such as loss of taste, loss of smell, early signs of infection. At the same time, we've evaluated certain procedures that are at the highest risk of spreading droplets that carry this infection into the air. And for those patients, we're going to be pre-testing them to look for any evidence that they may have the virus and possibly be without symptoms. So taking precautions from every angle to, again, keep the hospital a safe place. We're also looking at resuming other services such as radiology, doing some more studies that we were putting on hold, looking at opening services such as our cardiac rehab, again, maintaining social distancing, maintaining masking, at all entrances into this hospital, looking at safety first. So that's a brief overview of where we are, and I'll pass it over to, I guess at this point, we'll go over to Parkridge and then Erlanger.
All right, thanks, Matt. Again, my name is Tim Grant. I'm the Chief Medical Officer at Parkridge Health System. And first, just want to start by thanking you all for being here and giving us the opportunity to share our story with you. We feel like what we've implemented here at Parkridge is that it's a good story, it's a positive story, and I'm happy to be able to communicate that to you. As of right now, all 5 Parkridge facilities remain open. They've remained open throughout this pandemic. Our emergency rooms continue to see patients. We continue to operate on a limited schedule, and we still see patients in our clinic. Of course, there's been a significant change in those processes and how that occurs. The conversation early on was mostly focused on surge planning, and now that has shifted more towards reopening more of our elective procedures, and of course that's the intent of the conversation today. We are grateful for our incredibly dedicated staff who continue to selflessly take care of our patients. And so just wanted to acknowledge them as well. Early on, as did the other 2 hospitals, we implemented our universal protection framework, which includes infection prevention, universal masking of all patients, visitors, staff members, PPE as appropriate depending on the situation, reinforcing the importance of hand hygiene. And then the second point would be our access control limitation of visitors, screening all staff, patients, and physicians, which includes temperature checks, distancing, which is, of course, social distancing and the cohorting of patients, and then changes in processes around patient flow within the facility. So that would include how we transport patients throughout the hospital, avoiding common areas, and just limiting access throughout different areas of the hospital for symptomatic patients or PUIs. As far as reopening our elective procedures, we are planning to do that at the end of this month, assuming that the executive order lapses at the end of April. And similar to Memorial, we plan on a staged approach to do that. We as well have a governance committee for our surgical services made up of surgeons, anesthesiologists, and Parkridge administrators that are all working together to ensure we do that in the safest manner possible. At all times during that reopening of elective procedures, we will keep a close eye on our available PPE, bed and ICU capacity, ventilator capacity, as well as testing capacity. And those things will determine how quickly and how far we go with elective procedures. We see this as a dial, not a switch on and off, but we understand that there may be the need to dial up and dial down a number of procedures that we're able to do based on PPE, bed capacity, ICU capacity, ventilator capacity, and testing. So we feel prepared, ready to continue with elective procedures, but just understand that we have processes in place that allow that to dial up and down. Tony, do you want to add anything?
No, at this point, we're cautiously optimistic. I believe everyone that's on would agree that we were fortunate to avoid some of the early predictions of surge potential, and we haven't seen that. Again, we stay cautiously optimistic and stay prepared to answer that need should it arise. And as Dr. Grant mentioned, the ability to dial up and dial back the extent of our other services that we're going to open up to provide now. If we trend or see that there are any changes in those statistics, obviously we'll be able to stand up the response side of our capabilities instead of our services side. So at this point, we're very comfortable with the measures that we've taken. Dr. Grant reiterated we do have limited access to the facility. We're still doing the screening. We're still doing universal masking. And we feel that this is the appropriate time that we can safely and effectively provide these extended services to the community, as Memorial pointed out earlier, that have been absent for too long, and we need to get those started back up. We feel that we can do that safely and effectively. Dr. Grant, if you don't have anything else, I guess we'll pass it to Erlanger.
Dr. Sizemore, if you all are okay.
All right. This is Jay Sizemore from Erlanger. Appreciate the opportunity to speak with you all today. Certainly during these trying times, Erlanger has taken many of the same steps that you've heard from the other two health systems, such as universal masking, cohorting patients, re-emphasis on hand hygiene, and visitation limitations, all which have proved to be helpful in mitigating the pandemic here locally. Just as a side note, it's also been very refreshing as a physician who's practiced here in Chattanooga for 15 years as to how the health systems have worked together during the epidemic. From an infection prevention and testing side, as we prepare to reopen, hopefully during the first week of May, we plan to keep things the same as well. So continue the same visitor restriction, ramp up of screening for those individuals coming in the hospital, continue with universal masking, and then look to continue our testing protocols and even the potential to expand our pre-elective surgery testing as our supplies allow. We think that this will continue to protect our patients, continue to protect our staff, and as a potential side benefit, allow the community to get a sense of where we may be as far as community prevalence as it relates to asymptomatic shedding. With more of the particulars with respect to reopening, I'm going to turn it over to Dr. Bouquet.
So our plan in reopening our elective surgical schedule will be deliberate, and we will focus on safety, both the safety for the patients as well as safety for the staff. In so doing, we will also make sure that we are good stewards of the PPE, the protective equipment that we have, and that we'll need for what may come as we open up the community as well. So we're looking, again, to do some limited screening, all these patients will be screened with some limited testing, and that will ramp up as testing becomes more available. Again, our goal is patient safety, as well as the other hospitals, patient safety, staff safety, in a deliberate manner so that we can do this stepwise, with the understanding that if we have a surge in COVID-19 patients, that we're ready to care for those patients and divert back to our disaster plans. That's all I have. I'll turn it back over to Memorial.
Thank you all. And I'd like just to close and then turn it over to you all from the media for questions. But I think what you are hearing is a coordinated effort by all three of us. I would say the leadership demonstrated by our community health systems has been, without doubt, I think one of the pearls of this pandemic for our community. We, from the early days, have been in contact with each other. We stay in contact constantly with each other. We make every attempt to coordinate where we can. And so I as a member of this community and my family who live here, I really think this is, again, one of the shining bright lights of what's happened in these last weeks related to the strength of our health systems here. in Chattanooga, in the Chattanooga area. So I think on behalf of Memorial, I want to thank Erlanger and Parkridge for your leadership and your cooperation and for leading this community. So with that, let's turn it over. I don't know if you all can see it there, Dr. Grant. Has anyone raised their hand for a question from the media?
Yeah, I'm not able to see that either, so we may just have to open it up.
Sorry, this is Latricia with WTVC. Would you like us to just go ahead and start asking questions?
Yes, ma'am. Go ahead, Latricia.
Okay, thank you. And first of all, thank you for providing us this opportunity to speak directly to you guys. This is so important, we feel like, for our viewers and for the community. So thanks for granting us this access. I'd love to hear from each health system on their opinion about why Hamilton County had such a high death rate. And we saw, our county being one of the 1 or 2 leading across the state. And we're now at 13 out of the 170 in the state. What contributing factors have you guys seen that might explain that, and any other insight you might have for that? Thank you.
I mean, I can certainly defer in some extent to Dr. Sizemore as an infectious disease specialist, but from our perspective, there's so many factors in looking at the mortality of this disease, the illness of the population. There are other illnesses that they carry. It's very difficult to compare one region specifically to another without looking at the specifics of each individual case. So it's hard to say that just because the mortality rate in Hamilton County was higher, that doesn't necessarily put a reflection on the healthcare or the degree of illness when they come to the hospital, how sick they are, but more so what other illnesses they have when they come to the hospital that place them at risk for passing from this disease. I'd be interested to hear also what Dr. Sizemore has to say in his perspective.
Yeah, so this is Jay Sizemore. I think another issue that definitely has to be considered just from an epidemiology standpoint is likely the denominator in Hamilton County is low just based on some of the testing characteristics that we have here. And what I mean by that, I suspect there's a fair number of asymptomatic individuals or mildly symptomatic individuals that over the course of time haven't been counted. I think as we continue to have more available testing resources and are able to expand testing within the community, both of symptomatic individuals as well as hopefully with some screening of asymptomatic individuals, you'll see that denominator grow, and I suspect that you'll pick up on some of these less severe infections, and you'll see the death rate drop.
This is Tim Grant at Parkridge. I completely agree with Dr. Sizemore. I do think it's a denominator issue. I don't believe that we've had the community testing availability that other communities have had. You've seen the long lines of drive-through testing that some other communities have had, and that just simply increases that denominator such that the rate would drop. And so I completely agree it's a denominator issue.
And just a quick follow-up, thanks for all that perspective. I believe it was a representative from Memorial that said we would have to look at the particular patient's individual cases. Is anyone doing that? Is anyone looking at all of our deaths in Hamilton County and their history and when they came to the hospital and really digging into those numbers to see if there is another factor here besides the lack of community testing? And if so, who is that?
This is Jay Sizemore from Erlanger. I think once the cases are identified, they're reported to the county health department and subsequently to the state. So really I think as far as any systematic research study, I'm not aware of anything that's being done, but certainly any additional investigation would be carried out by the Chattanooga-Hamilton County Health Department.
This is Joy Dukes with Channel 3. So, Tennessee's governor is planning to reopen next Friday. You have Georgia that is supposed to begin reopening this Friday. In your opinion, do you think that based off of what you all are seeing and what you've dealt with on the front lines, that we're prepared to reopen?
This is Tony Houston from Memorial. I'll just start. I want to reemphasize what you've heard from the health systems. This is our business, right? To keep each other safe, to have safety first for our patients and our caregivers, and we've been doing that consistently throughout. Our goal will continue to be that, and so you've heard us all talk about the measures we'll take, the measures we have taken in order to ensure safety. I think as stewards of our health system, we collectively have demonstrated our ability to do so. And I'll speak for Memorial. Our intention would be to hopefully continue to be that example and let other businesses, as they start to think about coming back online or other of our social gatherings that start to come back online, like churches, et cetera, that we continue to practice the social distancing, the hand hygiene, the universal masking that I think we've proven in the health systems that has kept us safe. It has protected us. And I would say that would be the recommendation that we would give to our community on whole, is to continue to practice these things that we have proven to work.
Well, someone from Erlanger had mentioned that they are still kind of preparing for the possibility of a surge. And we've also heard nationally just some concern over whether there may be a second wave of this coming in the fall, should we choose to reopen at this time. So I guess we're wondering, are you prepared? We understand that you all have been preparing for this and you've been doing as much as you can, but do you feel confident that you have all of the resources that you need to mitigate that, whether that be a surge now or a surge in the fall?
This is Tony Sylvester Parkridge. The pandemic situation isn't unique to the emergency preparedness folks at these facilities. There have been multiple other occasions. This has been things that we have planned for and drilled for in the past. So we'll maintain a state of readiness that if a surge does present, we'll still be able to answer that with our preparations. I don't believe any of the health systems intends to totally dismantle their surge plans or anything else and start up and back to business as usual. We'll maintain a state of readiness until we feel that that's no longer necessary. All the health systems maintain a state of readiness with surge planning and disaster planning. All the hospitals in this area are members of the Regional Healthcare Coalition. We meet quarterly to discuss these very things, and we've done that for several years. It's a part of the hospital that we plan for and that we kind of in the background are prepared for on a routine basis. So we'll still maintain a posture of readiness, but at this point we feel very comfortable that we can begin to extend our services again in a safe manner with caution. As Memorial said, inform the public that they may need to maintain social distancing, hand hygiene, all the measures that were put in place. But at this point, we feel we can do this in a safe manner, cautiously. Dr. Grant said it's a dial, not a switch. We'll go back to that, and that we'll move in a slow, methodical manner so that we make sure that we maintain the safety of not only our staff and our facilities, but the community, and are able to offer these services in a safe manner.
Hi, guys. This is Emily Kulik from WRCB. We are wondering how many patients are currently hospitalized, including all three hospitals, from COVID-19 in Hamilton County.
Emily, it's Tony again Tony Houston from Memorial. I would point you towards our health department. That's the group that has helped all of us communicate to you all those types of statistics. So I would ask you to follow up with them. They are our representatives collectively to give you that information.
Okay, and quick follow-up. Chattanooga Mayor Andy Burke and Hamilton County Mayor Jim Coppinger have both pointed to medical data as far as what they're using to reopen the economy. What is your influence, each hospital? What is your influence in that decision making when it comes to reopening the economy?
This is Tim Grant at Parkridge. I can tell you that the mayor's task force has representation from each of the three facilities. I know I'm on it for Parkridge. Dr. Sizemore is on it for Erlanger, and there are representatives from Memorial as well. All three CEOs from each hospital are on that. So we meet, that task force meets weekly. And so we feel like we have an open communication with the mayors through that mayor's task force.
This is Joy Jukes with Channel 3 again. You guys have mentioned that you feel like you are prepared in the event that there is a second wave of COVID-19 or a surge. Can you kind of explain to us or give us an idea of how many ventilators you have available, how many beds you have available, what your capacity is for patients with COVID-19?
Joy, again, it's Tony Houston from Memorial. That information we have collectively out there. I can tell you what we have as an organization here at Memorial. I don't know, Lisa, are we? I think that our PIOs have agreed to make sure all that information comes through. Again, the Hamilton County Health Department and the Chattanooga Medical Association. We've been able to send that out to you collectively. That way, we, as Tony said from Parkridge, we update that constantly with each other through our emergency preparedness system. And so that does modify and change each day depending on the types of patients we're taking care of. So I'd point you to those folks to give you that information.
Hi, this is Elizabeth from the Times Free Press. Have y'all already started scheduling these elective procedures? And if so, what's the interest level and confidence you're getting from patients? And this kind of is the second question I have that relates. What will need to happen before you begin loosening your visitation policies? I've heard from readers quite a bit that some of their hesitancy in coming to the hospitals, be it for emergency or elective procedure, is that they're going to be alone.
So let's see, the first question would be, have we started scheduling? Because a lot of these procedures have to be scheduled well in advance. We have started to put tentatively procedures on the schedule, realizing that if the governor doesn't let the edict lapse on elective surgeries, then we'll certainly move those surgeries further out. But we have started tentatively scheduling those. The second part of your question, I know the visitation was the third. Remind me what the second was?
Just how receptive are patients to getting elective procedures right now?
Certainly there are patients who are still concerned about coming to the hospital. And I think, honestly, that's why this sort of session is so valuable, because we really want to reiterate to those patients out there that we are keeping the hospitals a safe place, as we always have, and that those who need medical care need to come to the hospital to get that medical care. Honestly, one of our concerns from day one, and I've said this before, and many of us have said it from all of the facilities, is that along with the risk of mortality from COVID, we're very concerned that there will be mortalities, and there have been, that we have heard of, from patients who are too concerned to come to the hospital to get the care that they absolutely need. And so we have had situations where patients have been contacted to schedule procedures, and they're still concerned to come and are hesitant. We're hoping that time will prove that as we open up to these procedures, if that's allowed as of May 1st, that will show we continue to remain safe and patients will feel more comfortable with coming. As far as visitation, it's very difficult. I don't think there's an absolute date as to when we're going to ease our visitation policies. I think the smartest thing, and we would all agree probably to do, would be to watch and wait, to not change anything, to allow more patients to come in for procedures, radiology studies, and to make sure that as we do that and as the community itself begins to open up, that we don't see that second surge or that surge to come. If we are comfortable after at least, I think, 14 days, because that's what we all talk about as the range of possibly becoming symptomatic, after that time period, that would be when we start thinking about making changes, but we may give it 4 weeks or longer. I think that would be the safest thing to do.
Dr. Grant at Parkridge and team said it well. It's a dial. It's not a switch. So we will have to see where we are as a community.
This is Tim Grant from Parkridge. I'll just comment as well that we too have begun scheduling these cases. We see most of our patients preoperatively in our what we call pre-anesthesia clinic. So patients will come in, be interviewed, history and physical taken in the clinic prior to surgery. So that is our opportunity to see the patients, speak to them, and try to allay any fears that they may have. Understand that most of those conversations prior to that are occurring with the surgeon. So we rely on that communication to occur prior to even scheduling the surgery. We recognize that there is anxiety, fear out there, but we're trying to do our part in educating the community that the hospital is a safe place to be right now. As far as visitation, our visitation policy is not going to change. So we plan to still have the limitation in visitation. One thing that we are offering, we have a large supply of iPads that we have acquired, and we have a process in place where we can provide telecommunication, video conferencing between families and patients. And that's been very successful. And patients have been very pleased with how that's worked.
Hi, this is Joy Dukes again with Channel 3. So across the country, obviously, we have seen the stories of medical professionals kind of on the front lines doing the good work, fighting the good fight against this virus, seeing what they're having to deal with. And we haven't really gotten to hear from you all about that piece of it, the human side of your doctors and your nurses who are working every day and can't see their families or whatever the case may be. What do you want to say to us about them? What would you like to communicate to our viewers about those medical professionals?
I think Dr. Grant mentioned at the beginning how appreciative we are. Our hospitalists, our nurses, our ER physicians, our proceduralists, everyone in the hospital has continued to work and really shown that the reason they went into medicine was to take care of sick patients, be that whatever the illness, whatever the risk to their own health, they're going to go out there and they're going to take care of the individuals who need help. And we can honestly not thank them enough for that. We've been very proud of our staff.
This is Tim Grant again from Parkridge. I'll just tell a quick story just to demonstrate that dedication. Recently, the evening of the tornadoes, we have two facilities, our Parkridge Valley facilities right off of Shallowford Road, and that the tornadoes went right through that area. And right after that, we had a group of healthcare providers, nurses that work at our Parkridge Valley Child and Adolescent Campus that were so concerned about the facility and the children and adolescents there that they got together and they walked, because the roads were impassable at the time, they walked to Parkridge Valley to check on the facility and the children there. So just an example of that dedication.
Is there any way those stories will be available to our viewers? Because that's something that they also want to be proud of. I know several of you guys had mentioned that, you're very proud of the work that the people working in the hospitals are doing. And residents also want to share that pride in saying, I know this person is working here and they've done this, and have that same sense of pride that you all were speaking about earlier.
I do know that our marketing team at Parkridge is putting something together around that particular story and how the tornadoes have impacted our Valley facility. So I would imagine there'll be something coming out about that in particular.
Yeah, Joy, I think our PIOs have all worked together. I know we talked about our healthcare heroes, and we've been trying to highlight those stories, as Dr. Grant shared, with the dedication, as Dr. Kazi mentioned earlier, of these professionals, these heroes that every day wake up and take care of their neighbors and their loved ones in this community. And it's inspiring to be a part of it, and we're happy to share those stories with you.
Right.
Hey guys, this is Latricia with WTVC again. I just wondered if you guys could give us an idea of what's different inside the hospitals right now. How are you physically changing what's inside to keep COVID patients isolated? Have you added changes to the ductwork? Like, what have you done that would make the hospital look different inside? And then also, one thing that we don't have access to through the health department and the PIOs is the level of PPE that you guys have access to. How is that supply right now? And how is the supply chain as far as getting more if you need it? Thank you.
So this is Ron Buchheit at Erlanger Medical Center. I'll speak. So the changes that we've made is, and I'll speak for kind of all the hospitals as well, but early on when we realized that this was easily transmitted, we created areas in our hospital that we isolate the COVID patients, the positive COVID patients, our COVID units, both in the ICU and on the med-surg floors. In an effort to keep them segregated from the rest of the population to decrease that infectious spread. As far as our physical facilities, we have negative pressure rooms and we have HVAC systems that are such that they're filtered air or vented air, so that again it's not spread through the hospital. Here we also created ORs that we use for surgeries that may come up in COVID positive patients or patients that are under investigation. So everything from screening at the door all the way through admission and then all the way out to discharge. We follow CDC recommendations as far as those that are positive, who have overcome the disease. We test them twice and separated by 24 hours, and then when they're negative, again, that gives us a signal that we can move them to another isolated, another room, and then safely discharge them. So again, it's a methodical approach that we're taking to ensure the safety of our staff as well as our patient population. I'll also speak on the supply chain. So this is an interesting thing. When we talk about disaster management, usually we think of like tornadoes or hurricanes, things that hit like one area of the country. The problem with COVID-19 is it hit the country all at once, and so everybody was fighting for the same needed supplies, all the hospitals in the area. And what we found out early on was that a lot of those areas that were hardest hit, some of the specialty equipment from PPE to testing was being diverted to those areas and showing back order in our systems. We would get small shipments of supplies, but again, not what we would fully order. As time has gone on, that has improved, and we're starting to see those supply chains come back online. And some of our orders are still being fulfilled. Now, that being said, everybody's still trying to buy N95 masks, gowns, gloves, face shields. And so those supply chains will remain to be taxed. And if we have a huge surge, that may become an issue. But again, as far as what we have now, we have adequate supply for staff and those patients in the COVID units.
This is Tim Grant from Parkridge again. The first part of your question about how things are different in the hospital, I would say that it feels very different, just in the fact that there's a lot fewer individuals around. Our cafeterias are closed. Our waiting rooms are empty. We haven't been doing as much surgery. Our emergency room volume has been about 50%, surgery volume down by almost 70%. So just the feel in the hospital is very different. That along with the limited entrances, the masking, the universal masking. So all those protocols, it just feels like the processes have changed dramatically within the last 2 months, but for good reason, obviously. I'll just stress real quickly, supply chain. Our processes are a little bit different. Parkridge is part of HCA, a national company. And so our supply chain is managed through our corporate headquarters in Nashville. We feel comfortable right now with the level of PPE that we have. We receive shipments of PPE from our corporate supply chain as needed, and they distribute it as needed. So we're just able to leverage the scale of HCA to acquire that PPE, and we feel very fortunate as to where we are right now, thus allowing us to move forward, feeling comfortable with opening elective procedures again.
And this is Tony Houston from Memorial. I'll echo what Dr. Grant and Dr. Buchheit said earlier. We have taken all the precautions to isolate the patients as necessary. We have pathways, as Tony said earlier from Parkridge. We drill this. We've implemented our plans, and that's worked very well for us to protect each other and protect our patients. And like Dr. Grant at HCA, Memorial is part of a large company, Common Spirit Health, and our supply chain is taxed. There's no doubt about it in our nation, in our world, as Dr. Buchheit said earlier. But we have enough PPE, the appropriate PPE, to slowly, start to open up. And again, I think the right approach is that dial metaphor that we used earlier, and that is, PPE is a huge variable and input as it relates to the decisions we make. And so if we get taxed, if the surge comes and PPE becomes an issue, then we move that dial back down and we work together to ensure that we have enough equipment to take care of each other. And so again, I want to emphasize the importance of our collaboration as the three health systems in partnership, working with each other to ensure we do this for the community, we do it well, and we keep each other safe.
Hi, Emily Kulik again with WRCB. We've heard a lot about the testing process between the health department and Baylor. What has the process been like for you guys with COVID-19 testing? What's the capacity each day, the number of tests you're able to complete, and how quickly do patients get those results?
So, this is Dr. Kotze. We've been very fortunate to have Baylor in the community. They've provided a great service in a number of ways because they have been able to easily accommodate the volume of testing that we've needed for our patients, both in the community and in the hospital. It has allowed us to save that PPE supply. When we first started this process before Baylor came on board, when LabCorp opened up their labs, a lot of us reached out and assumed a national lab would be able to handle the burden, but they rapidly got inundated with tests from around the country, and the wait time was anywhere from 7 to 10 days. And you can imagine the amount of personal protective equipment we might use on a single patient staying in our COVID unit for 7 or 10 days versus what we use now. When we send our test to Baylor, we have shipments every day. A shipment that goes in the morning, we might have that result that evening. And that's 1/10 of what we would have used before. So it's been incredibly helpful to have them to provide that service.
This is Tim Grant. It's almost as if the testing available to us has been in about 3 phases. So first, we had LabCorp, which we had the same problems that Dr. Kotze was talking about, where we had some 7-day turnarounds. When you have 7-day turnaround on a test, the amount of PPE you burn through is incredible. We actually measured it one day. We had a patient in the ICU, and we went through 60 units of PPE on one patient in one day. So if you multiply that times 7, you can see why PPE became such an issue. The second phase of testing was when Baylor opened, and then we feel it's been an incredible service for us, and we were able to get that quicker turnaround. And we're now in a third phase where we have in-house testing here at Parkridge, and we can get results in an hour. So that is even more useful if we have a patient come in that's being admitted or even a healthcare worker. We can test them and get that result now in an hour.
This is Jay Sizemore from Erlanger. Just concur and agree with the statements that have been made so far, especially with Tim's use of the 3 phases of testing. We too started out with the state and LabCorp and had slow turnaround and high PPE burn rates. Then with the availability of the Baylor lab and other labs to have same-day testing turnaround, that allowed us to preserve our PPE, and we're thankful for the availability of that testing. And as time has evolved now with our in-house capability, we're in the process of validating those test systems as well. And all of this will just allow us to test both our in-hospital patients as well as our community members, and that allows us to keep our communities safer and take better care of those patients.
We have time for one more question.
Hi, this is Elizabeth with the Times Free Press. I just was hoping y'all could speak briefly about your outpatient services and if, how that plays into the mix, and if any of these elective procedures will be happening in outpatient. Is that more of a factor or less of a factor now?
So from outpatient services perspective, there's different avenues or different things to consider. The outpatient clinics, in addition, of course, to the outpatient procedures, the majority of our procedures that we'll be starting with will actually be on outpatients. That said, the outpatient clinics have been fortunate, I'm sure it's the same in all the systems and around the country and the world. They've made great use of telemedicine. And the insurance companies have been incredibly helpful in understanding and changing their policies, how they reimburse those services. And honestly, it's provided the opportunity to give care to patients who otherwise by no means would have been able to see a physician. And they're literally seeing them on the telemedicine. That said, I think, and I'm sure the other health systems would agree, that this may change how we practice medicine in the future. That we already know that there are patients out there who have difficulty coming to a clinic before there was a pandemic. And the availability of telemedicine and how that has rapidly evolved has changed the way we practice. We will be reopening the clinics again in a scaled fashion as we're going to be reopening our procedures. And we'll take that and watch as it goes.
Yeah, this is Tim Grant. I'll just say, when we say elective surgery, you got to keep in mind that a lot of elective surgery is outpatient surgery. So we are absolutely intending on, once our elective surgery opens, that many of those procedures will be outpatient procedures.
Really quickly before you guys go, can you kind of also talk to us about what you've learned about treating the virus through all of this, and about transparency with the community as you're working through any difficulties you may be having, or any issues with this situation?
This is Jay Sizemore from Erlanger. I think all of us in the medical profession have a tendency or a desire to obviously help people, and so as this pandemic evolved, there were certainly anecdotal reports of different sorts of therapy that may be effective in helping these patients, especially those that became severely ill, to have a better outcome. I think to date, what we've learned is really a lot of the management boils down to supportive care. Certainly, there are therapies that are out there, some directly acting antivirals that could be effective. But I think what we've learned is that those are likely best studied in the setting of clinical trials, and we have to resist the urge to accept unproven therapies. I think as we continue to see cases, as we're able to continue to carry out these studies, hopefully more effective therapies will emerge. And then from a community health perspective, obviously the development of a vaccine, hopefully in the next 12 to 18 months, would serve us all well.
And I'll just close. Thank you again for your support of our health systems here. We thank you for giving us an opportunity to share our stories. And I just want to continue to emphasize and amplify the coordination and collaboration of your three health systems here in our community. I think, as Dr. Sizemore said it quite well, these people are dedicated. They want to serve. They've spent their lives in training and education to be ready for a moment like this. And I would just ask us to continue to lean in together as we bring back to our community the needed health services, and we stand ready if something were to happen, as Tony said earlier, to activate again our continued surge plans. So again, please celebrate our healthcare heroes. Continue to support our health systems. We stand ready and are prepared to start to turn back on some selected services to treat Chattanoogans.
Hey guys, thank you so much. This is Latricia with Channel 9. As we close, could we plan to do this maybe in 2 weeks again? Would you guys be open to making a commitment to doing another one of these in the near future? This has been so helpful for us in the community.
I'll definitely let our PIOs get with you. I think I'll speak for Memorial. We stand ready to continue to do this work. And as Dr. Grant said, we are in constant contact with each other. We speak often. And so coordinating this is probably something we can do without much work. We'll let our PIOs connect with you about that.
Thank you.
Thanks, everyone.
Thank you.
Stay safe.
You too.